Welcome to Module 1 of our Anal Cancer Patient Education Series, Anal Cancer 101. My name is Cullen Taniguchi, GI Radiation Oncologist here at MD Anderson. This video will provide some basic information about anal cancer and the initial process that is required to work up this disease. First, what is anal cancer? Anal cancer is a rare type of gastrointestinal cancer that starts in the anal canal. It affects about 9,000 new patients in the United States each year. The most common type of anal cancer is called squamous cell carcinoma, which is the focus of these materials. Take two. Next, where is anal cancer found? The anal canal is at the very bottom of the gastrointestinal tract and is located in the pelvis. The average anal canal is 1.5 inches long and connects the rectum, which holds the stool, to the anus, which is the opening through which stool exits the body. There are muscles around the anal canal that allow the stool to pass through by relaxing. The skin around the anus is called the perianal area. And sometimes anal cancers can also involve this perianal skin. Cancer in the anal canal can sometimes spread to lymph nodes in the pelvis and in the groin. Because of this, these lymph node areas are typically treated as part of the anal cancer treatment. 2. Anal cancer is rare. There are some known risk factors that increase a person's chance for developing anal cancer. The biggest risk factor for developing anal cancer is infection with human papillomavirus, or HPV for short. HPV is a virus that most commonly is transmitted through sexual or skin-to-skin contact. HPV is very common, and getting it does not indicate promiscuous or risky behavior. Nearly all sexually active adults get the virus during their lifetime. Most people who get the virus will not develop HPV-associated cancer, but it does increase the risk of a cancer diagnosis. Other risk factors for anal cancer include cigarette smoking, a weakened immune system, such as from HIV or taking immunosuppressive drugs, an anal fistula, which is an abnormal tunnel between the anal canal and the skin, or frequent anal irritation. Age is also a risk factor for anal cancer, as this type of cancer develops over many years. For all patients with anal cancer, certain tests are required to learn exactly where the cancer is and to see if it has spread before treatment is started. Blood tests will be taken to test your blood counts, salts, and electrolytes, as well as function of your liver and kidney. An HIV test will also be performed. Anal cancer is usually felt on a digital rectal exam. During this exam, the doctor inserts a gloved finger into the anus to feel the mass to determine its size and location. It is an important test to do a diagnosis and also a follow-up after treatment. Anal cancer is best seen with an endoscopic or camera scope exam. Flexible sigmoidoscopy or anoscopy are done in the office by a colorectal surgeon. Pictures and measurements are taken of the tumor during this exam. This is important to figure out the T stage, which I will explain in the next section. This type of exam is also important after treatment is finished to make sure the tumor goes away, as well as to monitor for any signs that the tumor may be growing back. For women, a gynecologic exam will be done to make sure cervical cancer screening is up to date. The treatment of anal cancer has a very high risk of causing infertility, or the inability to have children, for both women and men. Fertility appointments can be scheduled for patients of childbearing age who desire more information about fertility preservation options, such as sperm banking, egg freezing, or ovarian transposition. Next, imaging tests will be done to look at the lymph nodes in the pelvis and the organs of the pelvis to see if the cancer has spread. The tests will also look at organs in the chest and abdomen to see if the cancer has metastasized. The lymph nodes and organs are best seen by an imaging study like computed tomography or CT, a scan with contrast. The scan is performed using a scanner that looks like a large donut. A CT scan can be combined with positron emission tomography or PET. For this combined scan, a radioactive sugar will be injected into the veins before the scan. The radioactive sugar is detected during the scan in areas of the body that use sugar more quickly, such as cancer, and they will, quote, light up on the PET scan. Some patients will need a magnetic resonance imaging or MRI scan if a higher resolution picture of the pelvis is needed. The tests we discussed will help your doctor determine what stage of cancer you have. Anal cancer is staged based on 3 factors called the T, N, and M stages. The T stage depends on the size and extent of the anal tumor. The N stage depends on whether the cancer has spread to lymph nodes in the groin or pelvis. The M stage depends on whether the cancer has spread to areas outside the pelvis, such as the liver and the lung. The overall stage depends on the combination of the T, N, and M stages. The cancer is stage 1 if the tumor is small, less than about an inch, and is not spread to nearby lymph nodes. The cancer is stage 2 if the tumor is bigger than about an inch and has not spread to nearby lymph nodes or other structures in the pelvis. The cancer is stage 3 if the tumor has spread to nearby lymph nodes or has invaded other pelvic organs like the vagina, prostate, or bladder. The cancer is stage 4 if the tumor has spread to organs outside the pelvis like the liver or lungs. This concludes our module on basic information about anal cancer. Thank you for your attention.